Welcome students. We are going to do the difference between OTC deficiency and orotic aciduria. Why we are going to do the difference? Because in both of them, orotic acid is increased in blood and urine. One is OTC deficiency, that is enzyme of urea cycle. What is the full form? It is ornithine transcarbamylase, second enzyme of urea cycle, which is most common urea cycle defect also, right? And orotic aciduria is defect in pyrimidine synthesis. In both of them, orotic acid is increased in blood and urine, but the difference is that there's no megaloblastic anemia in OTC deficiency, but megaloblastic anemia occurs in case of pyrimidine defect, that is orotic aciduria. And one more difference, that hyperammonemia occurs in OTC deficiency but no hyperammonemia in orotic aciduria.